This is Tori Novak, and this is going to be video 6 of spirometry. You want to make sure that you have calibrated your device using the 3-liter syringe. You need to make sure that your device is in proper working order. You need to explain to your patient what you're going to be doing with them, and you need to reiterate these things throughout the process of the test. Wash your hands. Make sure you introduce yourself and your department. You want to put the equipment together aseptically and instruct your patient to sit up nice and tall, feet flat on the ground, with their teeth and lips sealed tightly around the mouthpiece. You're going to instruct them on what to do with the maneuvers, and then you're going to coach them through it. You want to make sure that your patient is able to reach their baseline so that they don't have any acute illnesses, dental work, they haven't had a big meal, they don't have clothes that are too tight, anything that might prevent them from getting the best results. If that's the case, then you do need to make sure that you reschedule. For these patients, you ask a series of tests. You want to know things like, do they smoke? If they do, how much do they smoke? How many packs a day do they smoke? If they don't smoke, you want to know how long it's been since they last have smoked. You want to find out about their occupation. And you also need to record the temperature in the room, height, weight, and race for these patients. So to coach your patient for slow vital capacity, you're going to say, okay, you've got your mouthpiece in, you've got your nose plugs on. I want you to take a deep breath in and breathe in. Keep breathing in until you can't breathe in anymore. And when you can't breathe in anymore, I want you to blow it out. I want you to keep blowing until you can't blow out anymore, and then you take that breath. We're going to do this at least 3 times, and I want you to just fill your lungs as much as you can, and then I want you to go ahead and breathe out. So I'm just going to demonstrate the slow vital capacity. So you have those 4 tidal volumes, and then you breathe in, okay. Then for your forced vital capacity, you're having them take that really steep, fast breath in, and then you want them to blast it out. You need them to blast it out for at least 6 seconds, but you want them to blast it out until there's no more air left in those lungs. This one you need to be a good cheerleader for, and then once they've got all the air out, they take that deep breath in again. So you say, okay, we're going to take a deep, fast breath in. And then you say, we're going to blast it out. And you say, blow, 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 blow. Keep blowing, keep blowing, keep blowing, keep blowing. More. Deep breath in. So I will demonstrate that as well. So we're going to do the deep, fast breath in. And so that would be for forced vital capacity. Then we also do pleth here, which is similar to the MVV kind of, except for pleth is like a panting. So you have them pant, and then there's a shudder, and then they keep panting against the shudder, and then you hear kind of a click. So you instruct them to pant short, shallow breaths, and to keep panting. They're going to feel like they can't because the shudder closes and it makes it feel unnatural, but you just instruct them to keep breathing through that shudder. So you would say, okay, normal breathing, and they'll do that, and then you say, okay, pant, keep going. Okay, that shudder's gonna close. I want you to keep going. For that test, they always say that there is a panic button inside the box because the box is closed, but there's also the 2-way microphone, so if they start feeling claustrophobic, they can push that button and it will release the door. So for the pleth, what they're gonna do is just it's similar to the MVV, but that's a deeper fast breath, so it's more like and that one is for 12 to 15 seconds. And then they also do the Delco at my facility. So the Delco is what's going to measure the diffusion capacity of the lungs with carbon monoxide, excuse me. So they breathe, they take a deep breath in, blow it out, and then the gases go through the mouthpiece. And so you have them suck it up, 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 and then you need them to hold it for 8 seconds. And then you want them to blow it out, and you want them to keep blowing, keep blowing, keep blowing, keep blowing, keep blowing, and then have them breathe that normal breath again. So that's kind of how you instruct them. You just cheerlead. So for the Delco test, they're breathing normally, deep breath in, and the gases come to So that's kind of how the Delco is. Of course, I'm not sitting up nice and tall like I should be, but that would be how that test would be performed. If you do the pre and the post, the Delco is only performed during the pre-test.